So are you taking regular sleeping medications for insomnia? Then this video is for you, because there are so many people who have insomnia or sleeping difficulty, but they are just happy to take sleeping medications only, and they are repeatedly taking it, and they are making it as a habit. This is a problem. Why it is a problem, I am telling you. And so first of all, insomnia is basically, if you are not able to, either you are not able to fall asleep, because it is a problem of onset of sleep. If you go to bed, then but you are not able to get sleep properly, so delay of your sleeping time. So this is one problem. This is difficulty in falling asleep. Another problem is maintenance of sleep, so fragmentation of sleep multiple times. So this is another problem, maintenance of sleep. And number three is early morning awakening. So you are just awaking multiple times at around 4 a.m. or 5 a.m. So this is early morning awakening. This is also a problem. So if you have any problems out of these three, and if you have these problems for many days, like at least 3 months, and I think 3 times per week, then you have insomnia. So if you actually have insomnia, then there are two types of therapy, two types of treatment approach. One is your pharmacotherapy. So pharmacotherapy, in the sense you understand that sleeping pills or sleeping medications. So whatever your doctors are prescribing, these sleeping medications you are taking regularly in every day before your bedtime, these are all pharmacotherapy. And okay, these sleeping pills give you instant relief, but these so-called sleeping pills, obviously I will not mention the names, but these so-called sleeping pills have some disadvantages also. If you are taking for regularly for too many years, then ultimately you develop tolerance and you will be addicted to this substance. Why? Because then if you don't take this medicine, then there will be rebound insomnia. You will not able to sleep properly. If you take also after so many years, then also you need to increase your dose. Otherwise, you will not get enough sleep, and it will be problematic. And ultimately, if you discontinue abruptly, you develop withdrawal symptoms. If you take short-acting drugs. So, what is the actual solution actually? So this is number one. Whatever I have mentioned, this is number one approach, pharmacotherapy. Number two is psychotherapy. This is cognitive behavioral therapy for insomnia, which is important. This can be provided by any psychologist or any therapist. But uh, if you don't want to go for proper therapy or session by session wise therapy, then I am telling you in this video, I am telling you some techniques and some tricks you can apply. So these techniques are based on this CBTI, or cognitive behavioral therapy. So you can apply some techniques of this CBT at your home if you don't want to go for this actual therapy. So now listen properly what you can do. So there are 5 things in this CBT. Number one is that universal sleep hygiene, and then number two is your stimulus control therapy. Number three is sleep restriction therapy, and then number four is your relaxation therapy, and number five is biofeedback. So there are 5 headings under this CBT or this therapy. So if you actually have insomnia, then follow whatever I am telling. So number one is universal sleep hygiene. Sleep hygiene is very much important. I am always telling you, and I made 2 videos also. It is very much important. Number one is that in sleep hygiene, that you should not take daytime nap. Very much important. Then your bedroom should be quiet and calm. There should be optimal temperature, and room should be dark during your sleep. And You should not use your mobile phone 2 hours before sleep. You should not use caffeine related content like your tea or coffee at night time. So these are all important things. And obviously, if you have anxiety, then you should treat your anxiety. So these are all important things we should follow. These are actually sleep hygiene. You should follow proper hygiene. You should not, you should not read at night or study at night. You should study at daytime and sleep properly at night. This is important. Approximately 7 to 9 hours of sleep per day is important for adult person. And for pediatric age group, for child, it should be much more. Sometimes 10 hours, then 14 hours of sleep are actually important. But people ignore it. Majority people ignore it. And they put ultimate pressure of any academic pressure, other pressure, this pressure, those pressure, but they forgot about sleep. This is very much important. So this is sleep hygiene. Number two is your stimulus control therapy. So basically, uh, there is one scientist known as Pavlov. So Ivan Pavlov did one experiment on dog. So I am telling you the experiment. So if you provide food to a dog, all right, if you provide food to a dog, then a dog releases saliva. And after some days, if you ring a bell while you are feeding your dog, then also your dog will release saliva. But interestingly, what happened after some days, if you don't give food also, if you only ring your bell, then also your dog releases saliva. So how? The first response, food is unconditioned response. When you ring your bell, this is conditioned response. And after sometimes, without this food also, your dog releases saliva. This is known as classical conditioning. And in our sleep habit also, this applies. So what happens if you use your bed for so many purposes? Actually, bed should be used for sleep, not for watching television or eating food or any other things. So basically what happens, sometimes people see television and they are lying down and resting but without any sleeping, and they are and gossiping, uh, and they are reading some books also. Okay, sometimes it is acceptable, but in always every day, if you are eating on bed, if you are seeing TV, if you are enjoying gossiping with your friends and some other activities on bed without sleeping, because at that time you don't sleep, you just use your bed for other purposes. So what happens when you actually go to sleep at night time? Then you cannot sleep properly. You feel difficulty falling asleep, and there will be delay of onset of sleep, because your brain will tell you that don't sleep because you use your bed for other purposes. When you use your bed for watching TV or other things, entertainment, then you don't sleep, you awake and you watch your TV. So when you go for sleep also, your brain associate that, yeah, this person came again for some entertainment, so you will not fall asleep. So this is one classical conditioning, conditioned response. So what you can do, you can also only use your bed for your sleeping purpose, not for any other purpose. This is stimulus control therapy. This is number three is sleep restriction therapy. So what you should do, basically, suppose you should sleep 7 to 9 hours per day or average 8 hours. But unfortunately, you sleep, I think, 5 hours. You should not, you cannot sleep more than that. You go to bed for your sleeping purpose, and you just lying down for 8 hours, but only able to sleep for 5 hours. So what you can do, you should not, lying down, you should not lying down whole time. If you don't able to sleep, suppose you are lying down, you are not able to sleep, you sleep is not coming, you just get away, you walk or do some other activities. And then also if you feeling some tired or feeling that you need to sleep, then you come. And it should not be less than 4 hours. Understand, at least you should utilize 4 hours of time on bed, although if you are not able to sleep. This is important. So in this way you should cut down your bedtime. You should cut down your bedtime. And then if you can able to sleep 5 hours, then only you lie down for 5 hours, not for 8 hours without any sleeping. So if you maintain 85% efficiency, means if you maintain 5 hours of sleep, proper sleep, without any distraction, 5 days out of these 7 days in a week, consistently for some weeks, then you can increase 15 minutes, like 5 hours 15 minutes. Then after some days 5 hours 30 minutes, after some days 5 hours 45 minutes, after some days 6 hours. In this way you increase your bedtime, and ultimately 8 hours or 9 hours. So in this way you will able to realize that yes, now you can able to sleep 8 hours daily. So this is sleep restriction therapy. First of all, you restrict your bedtime, then you increase gradually as per your body response, as per your your response, that whether you are able to sleep or not. And ultimately, number 4 is relaxation therapy. Relaxation means there are some deep breathing exercises. Deep breathing means you should uh, breathe, inhale deeply. So you should inhale deep, and then you should stuck for some seconds, like 4 seconds, and then you should exhale slowly, 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 and up to 8 seconds. So in this way, you should repeatedly do it. So in this way, deep breathing should be done. So in morning time as well as in night time. So apart from this deep breathing, so another technique will be that Jacobson's progressive muscular relaxation. So progressive muscular relaxation means any types of muscle group, like head muscle, neck, and then hand, any type of body muscle groups should be tensed for some seconds and then progressively relaxed for some second. So tense, relax. So in this way you need to apply this. And then guided imagery. Guided imagery means you can imagine a beautiful scene, pleasant scene, that you are lying down, all right, and you are feeling relaxed. So in this way. And ultimately biofeedback. Biofeedback means to measure some body temperature, uh, then muscle tension, how much muscle tension is present. So these are actually professional setting. If it can be done in professional setting, forget about it. So ultimately what you should do, basically apply a good sleeping hygiene, very much important. Then your stimulus control therapy, use your bed only for sleeping purpose, and then ultimately cut down your sleeping time if you cannot able to sleep, and then gradually you increase your time as your body adapt. So this is sleep restriction, and then ultimately your some relaxation technique. So if you apply all these things, I think that you will be able to sleep properly, and ultimately you can quit your sleeping medication also after a certain period of time. So I think this video will be helpful. But yeah, for short period of time, sleeping medication will be helpful. But for long period of time, you should adapt this technique so that you need not take this medication for your lifetime. So thank you for watching this video. Stay healthy, stay tuned.